So Emily's going to start by turning that blue stopcock off to the transducer so she can fill that syringe up with normal saline. When she does that, she's going to go to her Phillips monitor and hit cardiac output. She's going to hit start CO, and it's going to tell her to inject now. So she's going to go ahead and push that saline into the Swan. As you can see, it says inject now under that gray bar right above pause alarms. That's kind of your cue when you're running hemodynamics. And you can see it kind of makes that little waveform there. That's how you knew you got a good push. She's going to fill that syringe again. It says prepare for next injection. So that should be your cue to go ahead and fill that syringe with NS. And then once it says inject now, she's going to go ahead and push again. This will be her second run of hemodynamics. And it should look very similar to your first run with that nice little waveform. If you look, you can see your first trial, which would be your push number 1, and you'll be also able to see your push number 2 once it goes through. It says prepare for next injection again, so that's when you're going to be filling that syringe. And then it will beep at you when it's time, and it will say inject now. And then Emily will go ahead and push that saline through. Then at this point, she's going to take that blue stopcock and turn it off to the syringe so that our CVP starts to come down so that it's actually reading the transducer rather than the pressure from the syringe, which she just did there. So off to the syringe so that we can get our normal CVP, which you can see will drop down to 3. Perfect. At this point, you can either hit stop CO or you can hit save CO, either way. Hit save CO to save your numbers, which we want to do every single time. Then you're going to hit hemocalc, and then you're going to pull your diastolic, PA diastolic pressure down to your wedge pressure, which in this case is 6. All of these need to be filled in. Once they are, you're going to hit perform calc, and then you're going to hit print record to save it to Cerner, and you're good to go.